everyone. Welcome, welcome. So glad to see you all here today. And if you have any ability to, we'd love for you to turn on your cameras so we can actually see you guys, have more of a face-to-face conversation. But of course, if that's not possible, we totally understand. And to get going today, I'd love to just start by having you guys share your name in the chat and maybe where you're calling in from and what you're most looking forward to getting out of today. So feel free to pop that in the chat. Let's make some introductions and actually start connecting and getting to know each other. And just some housekeeping rules. Please just try to make sure that you are on mute today so that we can hear all our amazing speakers. So nice to see everyone starting to enter in the chat, say where you're calling in from. So great. All right, and with that, we're going to get started. And if at any time, feel free to pop comments in the chat, or we will be doing Q&A at the end. So if you have some questions, feel free to write them down and we'll go back to those and answer them through the Q&A portion. And with that, we will get going. So I'm really, really excited to welcome you all to our first ever Loneliness Awareness Week panel on older adult social health, which I think we can all agree is a really important conversation to be having right now. I'm Bobby Breckenridge. I'm GenWell's Community Development Manager, and I'm just so thrilled to be here with you all today. And I wanted to share that we're hosting this as part of our launch of Loneliness Awareness Week, which is happening from June 10th to June 16th as part of a global effort. And just a reminder to please mute yourself, guys. Thank you. And Loneliness Awareness Week is a part of a global effort to raise awareness about the growing loneliness epidemic. It's a week when GenWell, which is Canada's Human Connection Movement, wants to inspire all Canadians to actually be more conscious of the growing issues of social isolation, disconnection, and loneliness that's actually being experienced by the older adults in our community today. And as a Human Connection Movement, GenWell's actually been on the mission since 2016 to educate, empower, and catalyze people to understand the importance of their social health and to actually understand the power of human connection as a proactive and inclusive solution that positively benefits everyone's health and well-being. And with that, I'm excited to just dive right in and begin to explore the social health challenges that older adults are experiencing in Canada today, and actually to have some discussions around how we can co-create more meaningful solutions to build a more connected Canada where everyone feels like they have the opportunity to thrive, regardless of their age or demographic. And I'm honored to welcome our three esteemed guest speakers that we have with us today to lead this conversation, starting with Dr. Samir Sinha, who's the Director of Geriatrics at Sinai Health System and the University Health Network in Toronto. He's a professor of medicine at U of T, a fellow of the Canadian Academy of Health Sciences, and the Director of Health Policy Research at Toronto Metropolitan University's National Institute on Aging. As a Rhodes Scholar, Samir is a highly regarded clinician and international expert in the care of older adults. And in 2021, he was actually appointed to serve as a member on the Government of Canada's National Seniors Council and recently led the successful development of Canada's new National Long-Term Care Services Standard. Welcome, Dr. Samir. So excited to have you here today. We're also joined by Dr. David Conn from CCSMH, who serves as the Executive Vice President at Baycrest Academy and is a renowned figure in geriatric psychiatry. His work spanning over the development of the guidelines for telepsychiatry to nursing home psychiatry has significantly contributed to enhancing seniors' mental health care. A prolific author and advocate, Dr. Conn's contributions have earned him multiple awards, making his impact on geriatric psychiatry in Canada and beyond. Welcome, Dr. David Conn. So excited to have you here today as well. And finally, but certainly not least, we have Dr. Franco Taverna from Companion Link, who's a professor at the University of Toronto that innovatively merges his expertise in neuroscience with community engaged learning. For over a decade, his students have supported seniors in long-term care, adapting to challenges like the pandemic with creative solutions. And his work highlights the importance of social connection and mental engagement in improving seniors' lives, demonstrating a commitment to holistic well-being. Welcome, Dr. Taverna. We are also so grateful to have you here today. And without further ado, we'll dive in to the panel discussion. So I'd love to start with you, Dr. Sinha, and love to start by discussing the loneliness epidemic that we're currently experiencing amongst older persons in Canada. And as I said, I was so impressed to see your presentation at the Community-Based Senior Sector Summit in Ottawa this week, and all the amazing work that you're actually doing to support people in Canada to age in the right place for them. So I'd love to hear a little bit more about why you think social isolation, disconnection, and loneliness is an issue for the aging population, and how does this actually impact their health and well-being?
Thanks a lot, Bobby. And again, thanks for having me here with my colleagues as well. And it's great to see so many people online today to participate in this conversation. Um, you talked about a recent presentation that I gave talking about the idea of aging in the right place, and how that's also linked to the issue of social isolation and loneliness. Because very much when we start researching what are the things that can threaten how we want to stay healthy and independent as we age, certainly one of the key things that can really threaten that is experiencing both social isolation and loneliness. And I know while we're focusing on older adults, I think it's always helpful to remind ourselves that this is a phenomenon that can happen throughout the life course. Young people and older people alike can experience this. And interestingly, there are a number of studies that say sometimes younger people are more affected by social isolation and loneliness than older people. In fact, one of the good news stories is while it's still certainly very common as we age, it's sometimes even more common in younger populations. And we saw this, for example, during the pandemic, that this was something that was experienced a lot more by younger populations versus older populations. But how extensive is this issue amongst the older population? Because I don't want to underplay it by any means. And one thing that we did is, we started working on this idea of social isolation and loneliness with a number of others through our National Institute on Aging, and we ended up doing a big report on this concept, and really helped to understand how it's measured in various different ways across the country. Lots of people use different scales and different measures, or even have different conceptualizations. So one of the things that we really focused on was the importance of trying to measure these things consistently, so we could get a really good number, because numbers would vary quite consistently across the country. And so we actually incorporated two short measures of both loneliness and social isolation as part of our annual National Institute on Aging survey. And what we were able to find was that in our latest data, we said that about 42% of older Canadians tell us that they are at risk of social isolation, of experiencing social isolation. Upwards of 58% of older Canadians have experienced some level of loneliness. So these are significant numbers when we think about them, and they're ones that we need to appreciate what the impact can be. Because certainly if you're experiencing social isolation, it could lead to experiencing loneliness. And they're not one and the same, but they certainly can be linked. And so if you're experiencing social isolation, it can lead to more issues of loneliness. And we know that this can lead to worsening mental health. It could lead to issues of depression or anxiety. It can lead to, other concerns, even seen as a risk factor for developing dementia as well. And so that's why we really want to focus on trying to combat this, and trying to support people as they age to not experience as much social isolation and loneliness. So when we talk about aging in the right place and we recognize that addressing social isolation and loneliness are part and parcel of helping people stay healthy and independent, we then start focusing on what are those solutions, because we know this is common. We know this happens throughout the life course, but it certainly is something that's experienced as we age. So what are the things that we can meaningfully do to address this? And this is where we really recognize that as people get older, they're more likely to outlive family members and friends. So they're more likely to be having fewer of those traditional social connections they may have been relying upon for years. And so one thing that we often recommend is that as we age, we try and find ways to help people develop new and robust social and meaningful connections with others. And this is where intergenerational programming and partnerships can happen. This is where it's important to think about making sure that people have access to good transportation mechanisms or programming that allows them to be able to get around their communities and to meet with others so that they have those opportunities to create new and meaningful social connections with each other as well. And by doing these sorts of things, we're hoping that that allows people to have less experiences of social isolation, the greater chances to develop meaningful connections with others, and therefore an opportunity to experience less loneliness and social isolation overall. So I'll stop there. I just wanted to give you a little bit of an overview of some of the work that we've been doing and some of the things that I'm thinking about, because certainly I do see this in my practice, in the patients that I see, and it's something that we want to make sure that we're really tackling because it's such a key determinant of aging well, especially in Canada. I'll stop there.
That's so beautiful. Thank you so much for sharing, Dr. Sinha. I really love that you brought in the piece that, social isolation and loneliness actually impacts everyone across the lifespan, and that we're actually seeing more research now that shows that younger people might even be more impacted than other parts of the population in Canada right now. I think that's also like so relevant to be having and really important, especially as we look at kind of some of the programming pieces you said around building new connections, maybe through intergenerational programming, and also offering more accessibility to services through transportation, through digital tech literacy, and through finding, yeah, more innovative ways to create more inclusion in our programming so that older adults can actually form. And I love how you said this, like new and more robust connections, which I think is always really important to look at when we're at that time of age where we could be experiencing a lot of grief and loss in our life and with the people that we've had really close social connections and circles with. So thank you for working those pieces in, because I think that's a really important part of the conversation that's not always kind of talked about as much. Um, with that, I'd love to kind of take the conversation over to you, Dr. Conn, and I'll spotlight you here. Um, Also, so great to see you again. You are so amazing last year at our Human Canadian Connection Conference. And also, I saw you present on the amazing work you're doing with the Canadian Clinical Guidelines on social isolation and loneliness in older adults. I'd be really curious to know, especially kind of going off of what Dr. Sinha said around,
Yeah.
people kind of underestimate the loneliness and social isolation that's being experienced across the lifespan. So curious to hear, if you actually think older adults or the broader population at large understand how important their social health is. And if not, why do you think there's a lack of understanding around that
Mm.
importance of our social health and how it impacts our well-being as we age through the lifespan?
Right. Thanks so much, Bobby. And thanks for your very kind introduction before. I don't think I've heard that one before, but um, and yeah, and just to mention that CCSMH is the Canadian Coalition for Seniors Mental Health. And two of my colleagues, Betty and Lisa, are online today. So thanks for being here, and might hear from you later. But for the last few years, we've been working on these guidelines. So these are clinical guidelines for health professionals and social service providers on how to actually recognize, screen for, assess, and then intervene if necessary in this whole area of social isolation and loneliness. So that's been an exciting project, and the guidelines are now available online at ccsmh.ca. And thankfully, due to the generosity of the anonymous foundation that supported the development of these guidelines, we're now in a sort of second phase where we're actually doing our very best to move the guidelines out there into the real world, into clinical practice, and into the communities. So you were asking, I think, whether people actually know that this is an important topic in general. And in fact, that term social health, I think, is a really interesting term in and of itself, because people sometimes think, well, there are social issues and there are healthcare issues, and they're different. And this is an area where they completely overlap, right? It's the social issue of being isolated and alone that, as Samir described, dramatically affects long-term outcomes in terms of your health, whether it's mental health, physical health. And it's a complex interaction, trying to figure out why that is the case. And the only way of understanding is, I think, through a biopsychosocial lens, meaning that there are physical, biological factors, psychological, and social environmental factors all interacting and intermingling, and all sorts of theories and ideas why it is that being isolated is not good for you. I think that people are beginning to get that message. I think it's getting out there, but it's slowly percolating society. We did surveys during the development of our guidelines. We did surveys of healthcare providers and social service providers, but also older adults. And we got more than 2,000 responses back from older adults about this issue. And when we ask specifically that question, are you aware, that isolation and loneliness can affect your mental health and physical health? A remarkably high percentage said they were aware of it, like remarkably high. The same for professionals, but what to do about it, I think, is the real challenge, and whether people know how to actually deal with it. So yeah, I think the message is getting out there. I don't know if people actually believe it, though. If we say, do you really believe that the fact that you don't have a lot of social contacts can actually really have a truly negative effect on your long-term health? I'm not sure people actually believe that, But that's our job, is to let them know and convince them, and do our very best to get the message out there. I think that whole question about whether older adults are more at risk is a really interesting one, because I think traditionally we've said yes, and there's all sorts of risk factors for older adults. You're much more likely to be living alone and to be widowed or divorced, and I think another point I wanted to make was about
just asking people to please mute if you're just hopping on.
That's great. Yeah. I just want to make the point that we talk about older adults as though there's some, single group.
Hello, how are you?
Good. How are you?
Hi, I'm
guys.
okay.
Jen, can you please mute? I'm trying to get
Nice to meet you.
the
Welcome.
person.
It's all
Thank you.
social connection.
So sorry about
It's
that.
good, Yeah. But I was going to make the point that, we talk about older adults as though they're a single group, and the diversity within the older population is dramatic, right? Just from age, if 65 is still the starting point, but all the way up to 100, and then people's living situations, their health situations are dramatically different. And the whether you're living in a city or a rural area is an interesting question there. Whether you're more at risk in a rural area or an urban area, actually, that's an interesting question for us to look at. But I think it's important that we recognize the diversity. And actually, one thing we really highlight in our guidelines as well is there's no simple formula here. You actually have to start with the individual, truly understanding where that person is coming from. And one last point I wanted to make, wearing my psychiatrist hat, is that a lot of people say this thing, social isolation and loneliness, as though it's sort of one package. And of course, there's a huge overlap, but they're different. And loneliness is so subjective. The only way of finding out if someone's lonely is to actually ask them. And healthcare providers often don't ask. And so one of the key messages in our guidelines is you have to start asking more often. So I'll stop there for now anyway.
Wow, yeah, so many like nuggets to pull out in what you just shared. I love that. So, and I think we'd agree at GenWell, we've seen that more and more people are kind of getting the term social health. Like there's, especially after the pandemic, I find more awareness that it does impact their physical and mental well-being. But kind of mirroring what you're saying, I think we're still seeing, you know, at a broad population scale, this need to like really believe like and really understand in a deep like embodied way how much it actually impacts. And I think you brought in a really relevant question there of, you know, some of the tricky pieces that people have is the what next. So how do we actually build the social connections? How do we actually get more connected, especially amidst, as you said, like the diversity that exists out there, and everyone's unique perspectives and skills and situations. And so it sounds like one of the recommendations you've really had, especially in the medical field and everyone you work with, is, you know, actually start to have those conversations and ask, because I know you've shared before, you know, loneliness can be a really uncomfortable topic for a lot of people because there's still a lot of stigma.
Yeah, absolutely. That's a critical point. Yeah.
Yeah. Yeah. And so I wonder if there's a piece here of also how do we make talking about loneliness more comfortable and actually, again, educating people to understand that it's really just the body and the brain's way of saying, hey, I need connection, just the same way it would when we're hungry or we're thirsty, versus as like, you know, something, a personal failure on you or something we should be ashamed of.
Yeah, there's huge stigma. And, you know, whenever I talk about this, I have this sort of favorite quote from Frida from Reichmann, who was a psychiatrist back in the 50s,
Wow.
who wrote that psychiatrists have really ignored this as a topic, that it's not even mentioned in most psychiatric textbooks. And she theorized, she was an analyst, she theorized that it's such a painful experience that basically we all do anything we can to avoid it, even discussing it, actually. So, and then to back that up, the DSM-5, which is our Bible of psychiatric diagnosis, which is over 1,000 pages long now, the latest version of it, only has one mention of loneliness in the 1,000 pages. And that comes in actually under prolonged grief, the prolonged grief of loneliness, which is an appropriate place for it. But other than that, it's just not mentioned.
Yeah. Wow. It's really interesting. Yeah. And it sounds like that's, you know, part of the education piece where we could all work towards, you know, this education around removing the stigma around loneliness so that we can actually have more open conversations about the solutions and how we build more connections in a more easeful and graceful way for people. So thank you. Thank you for sharing that. Such great thoughts. And with that, I'm going to invite Dr. Taverna into the conversation here, and kind of going off of really what we were starting to speak of around the solutions and around the, okay, so we know that loneliness is important and it's impacting people. We know that social connection is a way that we can really address this, but a lot of people saying, well, how do we do that? I know that you guys are doing amazing work at Companion Link to actually create more of those intergenerational connections, which are, you know, just so important. You know, we've seen the host of benefits for young people and old people with that. And so I was wondering if you could kind of share your views on the solutions that are available to get older adults more connected in their communities, and what are some of those benefits for society at large, because we know that the benefits are, you know, so much deeper than just older adults.
Thank you, Bobby, and it's my pleasure to be here, especially with the two other panelists. It's a real honor. And yeah, thanks for the question about what we can do and what we've been doing. I personally came to this focus relatively recently while I've been, having my students visit long-term care facilities for 16 years now. It wasn't until pandemic when we started shaping and refocusing, inspired by my students, the notion of loneliness and isolation as a major focus for this intergenerational activity that was happening. And what has really caught my attention in learning about this issue over the last few years, number one, how corrosive loneliness and isolation can be, especially since we know it's associated with despair and stress, and we know how corrosive those are to the brain, and so yes, the health and mental health, physical health consequences are very real, especially for older people who are also facing other health issues, and the power of a social connection, whether that's family or friends, and as other panelists have said, how those are lost, or they can be more and more lost as we age. So the other thing that really captured my attention is that, a solution here, or I shouldn't say a solution, but part of a solution here is not a massive amount of social connection for an individual, but just a handful of close, regular friendships can make a difference, perhaps to replace the ones that are lost as we age. That's from research from the Canadian Alliance for Social Connection and Health. Just 2 to 3 close, regular friendships can have a big impact on social health and on health for older people. So the organization we created does just that. It's a one-on-one intergenerational friendship, and we very, very intentionally have invested lots of time into training of the young part of the dyad, the young people, who are, many of them are students, university students, very, very motivated, very interested in healthcare, and very sort of eager to learn about issues and to learn about what they can do. So really awareness training on loneliness, training on how to make a friend of a senior, training on recognizing things like David mentioned, mental health issues, or recognizing other issues in their new friend. Those, we focus a lot on that. So as part of the solution, that one strong friendship that we're trying to facilitate and nurture here, we're hoping, and we're doing research on this to see if and what kind of an impact that can have on the senior. Can that improve that senior's health, let alone can it reduce loneliness and social isolation? So a strong intergenerational friendship, and as Dr. Sinha said, young people are lonely as well. So we've come to see that this has, as perhaps, I don't know if as big is the right term, but has a big impact on the young person in the dyad as well, for their social connection, for their social skills, for their ability to be able to initiate and deepen friendships and relationships. So it really has a dual benefit. So this, one-to-one, social connection has turned out to be something more powerful than we imagined. I'd like to mention also something that Dr. Conn brought up, the idea that, while many older adults are aware that they may be lonely or socially isolated, they don't necessarily want to admit it, or there's a stigma behind trying to do something about it. So how you approach, an intervention, whatever it might be, whether it's a one-on-one intergenerational friendship, for the senior, we found to be an interesting topic, or an interesting concept. And if we lead with, hey, how would you like to make a friend with a young person to reduce your loneliness, or your loneliness? Sometimes we get, hey, I'm not lonely. We get resistance to that. But if you lead with something like, hey, how would you like to chat with a young person to perhaps, share your wisdom with them, help them learn about, your experiences or something like that, and just to become friends, then they're far more receptive to that idea. So we've learned a lot just from this one-to-one connection, and we think it's a very powerful way to imagine that, one of these connections can be a large chunk of that 2 to 3, friendships that can go a long way to improve health. I think is really fascinating and interesting.
Yeah, thank you so much, Dr. Taverna. I love what you shared here. It's very resonant. We're coming out with the Canadian social health guidelines very soon, with hopefully within the year. And what we found in our research as well is exactly what you're saying. It's, these few connections, like ours is like 3 to 5, that are really like your core group of people, that really these are the people that you actually feel like you can rely on and that you can be close to and yourself with. And that's actually been shown to be one of the most important things we could do for our social connection. So I love that you brought that into conversation, because I think sometimes it can be overwhelming and people think, oh, like I got to go do this or I got to do that, or I need to make all these new friends, and it gets really overwhelming. But when you're like, no, you just have to form one new close really relationship, or focus on the close people you have, it's it feels a lot more manageable. And I love what you shared there around the intergenerational relationships. I'm a huge proponent of it myself. I actually have quite a few older adult friends who are like my rocks. And I love what you shared there. I know that I'll speak about my connections with my older adult friends. I know that I'm definitely a rock for them, and I've provided them a big sense of purpose. Like, they love the mentorship and the connection. And I'm the person they call if they like break their arm and they need someone to like just come clean around the house or whatever. But kind of as you said, like, it's never been led with like I'm helping them be less socially isolated and lonely, and they're helping me like develop all the skills I need to grow into like a well-rounded mature adult. But when it was led more with like, we met through networking, and that idea of like, hey, like, can we just connect, and like, can you give me some mentorship, and let it grow naturally from there. So I love that you brought that piece in, because I think it feels a lot more approachable when we approach that conversation through like, you have so much value and benefit to bring to others. Like, would you be willing to share that, versus like, your population is known to be more socially isolated and lonely, and like, would you like to do this so that you feel less lonely yourself? That doesn't feel as inviting and warm. So I think that's like a really important distinction of when we're building these programs, how do we actually approach and have that conversation so that it's more accessible for people to want to say yes to. So I'm really excited. Now I'm going to actually spotlight all three of you, and we're going to get in more deeply to this this conversation we're kind of having around the practical steps and strategies that we can all kind of use to work towards building more connection in our communities. So with that, I'm just going to take a second to highlight Dr. David Conn, add a spotlight, and we'll bring Dr. Sinha back. Trying to find you here. It's always fun trying to search through everyone on the screen. There we are. Beautiful. And again, just reminding you, if you notice you're unmuted, to please mute yourself. Beautiful. All right. Thank you all. So nice to see everyone on the screen. And so, as I said, I'd really love to discuss these practical steps and strategies that we can all work towards to create more connections for older adults within their communities. And Dr. Sinha, I'd really love to start with you and hear more about the work you're doing with the National Long-Term Care Services Standard. And I'm curious, how do you feel this standard will help kind of create more possibilities for older persons to get connected and, as you said, kind of age in the right place?
Yeah, so I mean, with the key first thing is that thinking about these issues in older adults, they transcend where people live, right? So they can, so certainly, you know, people think that, oh, loneliness and social isolation only occurs for people who are community dwelling, meaning they're living in their own homes in their communities, for example. It doesn't happen if you're living with family members. It doesn't happen if you're living in a retirement home or even a long-term care home. But it really can happen anywhere, because you can certainly be surrounded by people, but you might not necessarily be connected to any of them. You may not have those real meaningful connections. So it's really important to kind of just remember that these issues can exist everywhere, and it's really that opportunity to create kind of more meaningful social connections. You know, that just like my colleagues were saying, right? You can find, as you said, just maybe even 3 to 5, or develop 3 to 5 strong connections. And sometimes that comes by trying to, you know, find ways to get connected with other people. Maybe there's specific interests that people actually have, that are a way to bring people together, and through that you form a connection with another person as well. So in the work we did with the new National Long-Term Care Services Standard, you know, we certainly were looking at kind of how do we support people of all ages who are living in long-term care settings, but really recognize the importance of not only thinking about quality of care, but quality of life. And really thinking about the role that, say, family members and friends also play in helping to support that, and really facilitating that in a way that helps to maintain good social connections, not only with people within the home, but also beyond the home as well. And when I think about my own practice, for example, I often think about older patients of mine who, again, might outlive family members and friends. Circumstances change, and then they might find themselves, you know, feeling quite isolated and lonely. I remember I have a lovely older lady who's in her mid-90s right now that I saw recently in clinic, and she was really expressing to me how the loneliness and isolation was really starting to get to her. And she has family. She has family, but they don't live in Toronto. And she really likes being an urban person, but she now has realized that I really don't have anybody locally in the city that I can really connect with. And so it was one of those sorts of things where I said, well, what's your intersection? What's the closest intersection you have? And then I remember she telling me, and then I said, you know what? There's this great senior center just literally a few blocks down. And she's like, what? So we went online, you know, I said, do you know this address? Do you know this church? And she's like, I do. And I said, well, and I actually went online with her. I printed out kind of the programming. I said, hey, are there any things here that interest you? And she said, oh, a movie night. That sounds kind of fun. And so, you know, it's one of those sorts of things where it's, you know, things that might seem obvious. Sometimes you just really need that support to help someone recognize that, yes, you are experiencing loneliness and isolation. There are things you can do, and maybe this is something there. And one thing that, you know, we've been trying to do through our clinic is, I know my nurse has been following up with her and just gently saying, did you make the call? Did you go down yet? You know, and just trying to encourage that, because sometimes you might find some people are a bit stuck. They just don't know how to make that connection. And so I think providing that support and that encouragement, you know, can be helpful. And then hopefully through that mechanism there, they'll actually be able to make more connections. And just like Dr. Taverna was saying, again, finding those, you know, just, you know, starting with one, and then growing that. And that could be with people your own age, but that intergenerational opportunity can be incredibly powerful as well. And so I think it's always important to think about where those exist. I know in, say, in the city of Toronto, they have a training program between, I think, younger people, you know, teaching older people how to use computers and improve their internet skills, for example. And while it's a mechanism to say, well, we're just doing a knowledge transfer that way, it's also an opportunity to build social connections. So again, thinking about creative ways and opportunities, and learning about those, and then finding ways to make sure that people know about them as well.
Thank you so much. I love that piece around just some support around like navigation of all the different services that are operating, and like a bit of hand holding there, because it can be like really overwhelming, especially when you're already feeling a bit disconnected and lonely to put yourself out there and do all this research and try to find all these things. And if you have some pieces where, you know, tech is a little bit harder to navigate, it creates so many barriers, where if you just have some people around you who did exactly what you did, it makes it so much more accessible, which is beautiful. And again, I love that kind of grassroots movement of looking at like, okay, so, you know, what assets do you have? Like, where are you already connected, and how can we just span that out just a little bit more? Um, so yeah, thank you so much. And it's kind of reminds me a bit of like the work being done in social prescribing to really be connected to those link workers who know how to do that. Um, and I'd be curious, actually I'll save that for the end because I want to ask the other things, and then I'll get back to it. But yeah, I'd love to go to you, Dr. Conn, and hear more about you know, the guidelines that your organization recently launched for healthcare professionals, and how these guidelines will really support older adults to get more connected, and maybe how they work alongside some of these other national strategies that are being developed to support people, you know, from both like anywhere from a prevention lens all the way to like more of a crisis lens.
Absolutely, yeah. So, yeah, and actually, I mean, the first section of the guidelines is about prevention and trying to anticipate when a person might become isolated or lonely, and that we can potentially intervene early. And you know, there are situations where we know that this is likely to happen now, and especially situations like a person losing their spouse, for example. So one thing to highlight in the guidelines, I think, is highly individualized approach. And rather than just saying, oh, everyone should just be more socially connected, it's actually trying to figure out why has this person become lonely or isolated? What are the factors that are contributing to that for that person? And is this a new problem, or is it a really long-standing problem? And there may be health issues that are impacting that could actually be solved. So hearing loss, we know how critical that is, right? So, you know, it could be as simple as getting hearing aids, because if you can't hear, you're going to become disconnected, right, from the world. And or if someone's depressed, or if they have a social anxiety problem, those can also be treated and fixed. So it's really trying to understand what is the problem, and then trying to come up with a plan that makes sense for that person. And then within the potential interventions, the first one we highlight is social prescribing. And Dr. Sinha, I think, perfectly described in his description of how he helped that patient. That is social prescribing, not in its formal sense where you have a link worker, but it's actually that warm hand, that helping the person to figure out what could be a really good connection for them. And that's fantastic. So yeah, of course, we highlight, you know, finding the optimal level of social activity for each person, which varies a lot. Not everyone has this incredible desire to be connected all the time. But and also we need to recognize the value of solitude, and recognize some people actually get a lot out of deliberately spending some time and choosing to spend some time alone. That's important as well, not to discount that. We mentioned psychological therapies, psychotherapies for some people could be helpful if their loneliness is actually deep rooted in their perception of themselves. And so figuring that out could be really, that's usually a person who talks about, you know, a long-standing issue of feeling lonely and disconnected. So, and then a variety of other types of interventions that have been shown to be helpful. Actually, physical activity, which is good for just about everything, seems to actually also help people who are lonely, and especially, of course, if they do group programs. But so that of course makes a lot of sense. Animal-assisted therapies, you know, pet therapies can be really helpful for some people. That bond with a pet can be fantastic. The great thing is if you walk outside with a dog, people start talking to you, right? And that's a fantastic way of being connected. And Yeah, so there's a whole variety of different types of approaches that we can take, but it's got to be individualized. And I think that's the key.
Thank you so much. Yeah, I love that piece around diversity because as you said, some people might need a lot of social connection. Like I have a lot of extroverted friends where like they need to be
Yeah.
out and connecting every single day. And then I have some friends where like they just need a coffee chat once a week and they feel comfortable like and that's great for them. So I think I love that piece you're bringing in of really understanding the unique issues that are there that the and what the desires are so that we can actually tailor different programming, different ideas, practices, different ways to get connected to that specific person. And I love that you also brought in that piece of like we need to be looking at, are there other barriers to getting connected beyond just the social connection part, because we know that that obviously can play a big role. And lastly, because I want to be mindful of time, and I have one more question for each of you, but I would love to go to Dr. Taverna, and kind of chat about, what steps anyone in the intervention space can really take to build more connection opportunities into their programming. Because I think we have a lot of service providers too that are more curious of like, how do we build more connections and opportunities, in our organizations with the programs we're offering. So yeah, I'd love to hear your perspective on that. Oh, you're muted.
Yeah, that's a great question, and certainly, echoing the comments of the earlier panelists about individual contexts and even, environment from long-term care to living at home. These are huge, determinants or complicating factors um, addressing this issue. Um, what comes to mind about long-term care in particular is that it's not a very friendly environment for social anything. And it would be much easier if it was very intentionally designed or built to be more of a community or social hub. And then the environment and the architecture or the design itself just welcomes social connection. You don't have to force it. It just happens, right? You invite the community, you invite kids, you invite schools, you invite family and friends, and it's just much easier to happen. So that could be something, just advocating for far easier, spaces, friendly spaces, especially for people that are living, for instance, in long-term care who would otherwise have an extremely difficult time, forging a new friendship or going out to a community program. Um, in some extent that I think applies to the 85% of older adults who are going to age for their whole life at home, that they start getting more and more issues with even going down to the corner to a community center. So following up or facilitating a social prescription with a friend or an advocate who could do things together with them sounds like a way, I think might be a way to really help this. And as you said, Bobby, this is double benefit, right? You enjoy it too, if it happens to be an intergenerational. And I would say perhaps lastly is fostering that relationship building rather than check-ins or different people communicating with seniors. The one-on-one or the small number to one kind of relationship building is very important. What came to mind, Dr. Sinha, when you um, Sinha, when you talked about the social prescription you gave, wouldn't it be nice if you can also hand that prescription over to a friend of that senior who could go together, right? Or you could help them. So, and that person would be, would have more subclinical or, pre-professional or, community level training and knowledge and awareness on how to, um, foster the biggest benefit for the senior. So that's what comes to mind about programming, trying to build more, small ratio relationships to get to know individuals and to really meet their needs, or whatever that might be, to help them one-on-one with community-based and then friendship-based services, rather than professional services, which is probably unsustainable in our society, right? Yeah.
Yeah, thank you so much. I love that piece around really bringing in the one-on-one or the small groups, because that's where we can really build the super meaningful connections, right? Where we see like such a host of health benefits for everyone. Um, I want to be mindful of the time. I feel like I could talk to you guys all day about this. So much like nuggets of wisdom coming out of this conversation. I have one more quick question that I'd love to ask, and to be mindful of the time, I'm going to open it up for a couple Q&As. Please note to everyone on the seminar, we may run just like a couple minutes over, but I really want to be mindful of everyone's time. So if you have a hard stop at one, there will be a recording and you can watch the end of this. But for those of you who can maybe stay a couple minutes after, so we can finish up, would love to have you guys stay with us. My last piece, because I want to be really mindful. I mean, I think we've brought in really great ideas, anywhere from like, service providers to healthcare workers to like the bigger kind of strategies that we can put in place. But, for everyday people, I'm thinking like family, friends, just like community members at large. What are a small, simple step that anyone could, starting today, work on or do to build more connections with the older adults in their lives, before we're getting into, social prescribing or seeing a doctor, or like those bigger pieces, but just, at an everyday level for everyday person, what are some simple small steps that anyone could do to build more connection with the older adults in their lives? And maybe I'll start with you, Dr. Conn, and yeah, we'll go from there.
Yeah, I think it's a matter of recognizing the understanding, I guess, what people need, the people who you feel close to, and perhaps reaching out a little bit more often. We're all using technology now, so we haven't mentioned much about technology, the good and the evil, but there are some real benefits, I think. So I think using the technology that's available to us can be really helpful, but a little bit more frequent contact, and recognizing that just a simple text, "How you doing?" can actually make a big difference. So yeah.
Yes, I love that. I know we promote that a lot at GenWell, just a simple text, "Hey, how are you doing? Let's get together for coffee next
Yeah.
week," or something like that. People really underestimate how much people love to receive those messages and what an impact it makes. So thank you so
Absolutely.
much. I'd love to hear your thoughts, Dr. Sinha.
Building exactly on what David was saying, it's just that when you're dealing with this at a doctor's office, or having to become more serious about it, it really reminds you about some of those lost opportunities that can happen really at that grassroots level. And so really thinking that we're just naturally connected to other people just by having relatives and family members, etc., and just reminding ourselves that there's a lot of loneliness and social isolation occurring, people of all ages, but also including maybe our older loved ones. And so it's just as David said, sometimes we just don't talk about it. It's a bit taboo. It may be a bit embarrassing for people to say, "Hey, I'm feeling a bit lonely or isolated." But I think certainly reaching out to your loved ones, for example, and just saying, "Do you ever get lonely? Do you know that, is there something, I can do?" And I remember, I've heard stories about, people saying, when I've done that check-in, for example, especially if I've encouraged them to do so, they've realized that, yeah, you know what, it really makes a difference, that weekly phone call. We schedule it in together, or, instead of just dropping off the grocery, that means we also turn it into a social visit, for example. And I just, and by saying, I'd like that, and actually thinking, do they want that, for example. Sometimes we just don't even think about these things because we're always in a hurry, but realize how much that would mean to both parties, can really mean, something much more. So I think it's really that opportunity to kind of just be more conscientious about this, thinking about, as you just said, our social health, and how, we can think about the people in our lives who might do better with those enhanced social connections, and how we might do better with those enhanced social connections as well. And just really encouraging just more, being more conscientious about that, because I think that can really facilitate some greater connections and greater connectivity.
Thank you so much. Yeah, I love that. And it feels very doable, right? Like when we're dropping off the groceries, just having a bit of time built in there to drop in, say hello, check in, see how it's going. And then, again, people underestimate how that small amount of time of just being really truly present with someone and being like, hey, how have you been? What's been going on? Can make a massive difference for people to feel like, well, yeah, this person cares about me and I have the support I need. So yeah, thank you for that. And love to end with you, Dr. Taverna, and a simple step anyone could take.
Yeah, I'd like to echo that. I think the key is regular, making it regular. In our companion link program, when we train our volunteers, we kind of may come off a little stern with this. We have a mandatory once a week phone call or visit, phone call, for a minimum of 6 months. But then we kind of talk about what that means and why we say that. And very quickly it becomes apparent of what the massive benefit is of putting it into your calendar and doing it once a week, or what may, and then you leave it go as your friendship, and it could evolve to once, twice a week, or 5 minutes one day, so it has to be regular. What would you do, really to foster the friendship? What do you do with your friends? And when something comes up that on television or internet or whatever, that I think, oh, my friend might be interested in that, and you just communicate with them. Hey, guess what I saw? Something that so you do the same thing as you would with any friendship, but that regularity of in the calendar is crucial. That brings double benefit. And then the quote unquote mandatory nature of it just melts away, and you realize that hey, this is a great thing for all of us.
Thank you. Yes, I'm a huge proponent of just schedule it in. I know I would not see any of my friends if we didn't have the long-term standing, like every 2 weeks we have a phone call or once a month we have a social, because we get so busy and so overwhelmed. And when we're in that state, it's hard to be really proactive about our social connections. And oftentimes I find, it's when we're the most overwhelmed that we need our people the most. And it's when we're the least likely to actually reach out and do that. So when it's actually just built into our calendar, it takes all the like guesswork out of it and just makes it so much easier, and you get in the habit. So I think that's a great answer. I want to be mindful of the time because we're at 1 p.m. now. I asked if you have any questions to drop them in the chat. We might be able to do one max. So yeah, I'll give a second to see if anyone has anything pressing they want to put in the chat. But if not, I think this was an amazing conversation. Um, Okay, I think this is a good question. We'll do this one question and then we'll wrap up to be mindful of everyone's time. The question we have in the chat is, for a senior who socially isolates themselves because they are vulnerable to the COVID virus, what would you recommend they do to remain socially connected? And feel free to popcorn style.
Yeah, one of the things we did through the NIA is we created an online tool called COVID Visit Risk, and this is something that was supported by the Public Health Agency of Canada, and we're now looking at kind of the usage of that tool, over 1.5 million visits, for example, and disproportionate uses by older adults, who are concerned about visiting safely with others. And that could be a tool that could be helpful, because we found that 80% of the folks who've used that have said it's really helped me visit more safely, because it's, what are those concerns? It's they might say, I'm really worried about not only COVID, but other viruses, and therefore I just don't want to visit at all. And again, if social connection is important, we give ideas and tips, for example, that maybe you keep the visits outdoors, for example, or, you can stay apart, if indoors, maybe people are wearing masks, maybe you can have a virtual component to it. There's a number of things that people can do to kind of visit, more safely with one another. And so, this is the thing. It's always kind of understanding what is making a person concerned about visiting with others, and then giving them some tips and ideas. And I think certainly there are things we can do to visit more safely with others, especially when we know, the value of that human connection, even if it ends up just being a virtual connection, which is the safest of them all, if you will.
Yeah, I would comment that we're still in this sort of post-pandemic phase, and there's a lot of lingering effects from the pandemic in terms of how we relate to others. We avoided people completely for a long time. On the street, you'd move right onto the road to get away from people. It was like became our habit was to be disconnected, safely disconnected. And I think there are some people out there who've remained avoidant, and it's become their habit, and that's the part of the problem with anxiety and anxiety disorders is that if you keep avoiding things, it actually gets worse and worse. So there are some people, I think, who've actually gotten stuck, and we have to really do our best to try to help them gradually reintegrate in spite of their fears. And it's a legitimate fear, of course, that you can still get COVID. It's still around, and it can be dangerous for older adults, and can for anybody actually. But I think we're still trying to find a new balance of safety, and we should be aware that there are some people who really need a lot of support at this time in kind of overcoming that fear.
Anything you'd like to add, Dr. Taverna? Oh, you're muted, just so you know.
Yeah, a phone or a virtual connection overcomes that. But and that perhaps that connection could help to start to address some of the issues that may be not logical, or they just may be just kind of too isolated. But so yeah, just a virtual connection is a start to try to overcome an issue like that.
Yeah, I love that. Well, thank you all so much for your time. This was an amazing discussion, so relevant. And as we wrap up our panel today, I just wanted to leave you all with the 5 simple steps that we've created for Loneliness Awareness Week to actually get more connected with the older adults in your life. And it echoes a lot of what the amazing panelists have said here today. So the first thing you can do is actually just say hello to an older adult when you're at a coffee shop or when you're in the lineup at the store. If you go to a community center or a gym and you notice, there's an older adult there that's all the time, just start with a simple, friendly hello. Our second simple step is actually take an older adult that you know out for a coffee or a meal. Again, and if they're not comfortable, maybe make it a virtual dinner or, whatever way that they're the most comfortable with. Third, we said take an older adult out for a walk outside nature around the block, as we kind of talked about today. Human connection and physical health go so well together, and it's always great. It's like 2 birds, 1 stone. Finally, we say just share in an experience, find a hobby or an activity that you both enjoy and do that. And, we are a face-to-face social connection movement, so we will always advocate for the benefits of getting connected in person. But, when that's not an option for people, substitute it with phone calls, with technology. So again, we want to thank you all so, so much for joining today. And if you want to learn more about Loneliness Awareness Week, I'm going to pop the site in the chat. And same with if you want to learn more about GenWell and the work that we do with older adults, I'll pop that in the chat, and feel free, panelists, if there's any links you want to pop in the chat for people to learn more about the amazing work that you guys are all doing and how they can support you, feel free to pop that in. Again, thank you all so much. Your expertise is just so amazing. And I'm always amazed by the compassion that you each all have. Like your hearts shine through when you speak about this. I can tell that, it means something to you, and to know that, you're all a part of shaping the future of what aging is going to look like in Canada is just so amazing and so exciting. And so we're very, very grateful for your time today and your expertise and all the amazing insights you brought to us. Thank you all again. And to everyone calling in, I know we had almost 100 people register, whether you're watching the recording or you were here live. Thank you for your time and for participating with us. We're so grateful to have you be a part of this conversation. And we look forward to having you all get more connected and more involved in your communities. All right. Have a beautiful day, everyone.